Okay, this video is Dr. Mcdougall corrected. So first of all, I think Dr. Mcdougall is the best doctor in the world. And he actually helped me when I was going through my fat phase to go to a starch-based diet. I'll give him credit for that. I think he's helped more people than any living doctor in the world. And one of the best things he does is he gives people a coherent approach to improving health by eating a starch-based diet. The most important thing I've ever learned in all my years of studying medicine and stuff, which is, gosh, a bazillion years, is to eat a starch-based diet. That's the most important thing you can know about human health, all right? But now, where am I having some disagreements with Dr. Mcdougall? He says that Alzheimer's can be diagnosed by history. That's actually questionable. He also says that, I mean, certainly that's done all the time, but how precise is that? You just know the patient's demented. There's not a precise physical finding, historical finding, laboratory finding, or imaging finding. And then he also says there's a pathognomonic diagnosis at autopsy by looking at senile plaques and neurofibrillary tangles. That's actually not correct. That's how it's been traditionally diagnosed, but they have a heck of a difficult time being precise about it. And a lot of times they're actually not correct. And you can see that there's so much problems with the overlap with Parkinson's and other causes of dementia. They came up with the reserve theory. I don't even want to get into it, but the point I'm saying is I personally think Alzheimer's dementia is an overrated thing. All right, let's go into some of the reasons for that. And he also says that aluminum is neurotoxic. Yes, aluminum is neurotoxic. Yes, there's a lot of papers showing aluminum is neurotoxic. That's all true. I've read a lot of these papers. I've read Exley's book, excellent book about the toxicity of aluminum. That's all good, and I agree with all that. However, it's important to be aware of other people. There's like Jack Torre Phd devoted his whole life to researching Alzheimer's. He's a guy who came up with the mouse equivalent theory, and he'd tie off the carotid artery of a mouse, and the mouse would become demented about 2 months later at autopsy. The brain on that side was not stroked out. It was just shrunken. That means apoptosis. The neurons are recycling themselves. That means they're gradually dying, and by recycling themselves, you can't see it on MRI. You can't see it at autopsy. So what I'm saying is, tons of things fit that. My personal experience of looking at many thousands of demented brains is they typically have cataracts and a lot of findings of atherosclerosis. Almost all of them have hypertension and diabetes. They totally fit a vascular pattern of disease. And Torre makes the point that patients still get dementia in areas that are not high aluminum exposure. He does not think aluminum explains it at all, okay? And what I would say is I think aluminum is neurotoxic. I think there's lots of good reasons to agree with that. However, there's many other things that are neurotoxic. I think vascular problems are the main cause, and then the subset of chemical problems and toxicity. For example, the mouse equivalences. Let's say you got hypertension. Very often they overtreat the hypertension. Why is the blood pressure high in the first place? To get blood to the top of the head. That's the hardest spot to get blood to when you're standing up. So the point is that when you overtreat hypertension, you drop the blood pressure to the brain, and a lot of those nerve cells aren't necessarily getting as much oxygen and glucose as they should if the hypertension is overtreated. And then you say, what else will do that? Of course, congestive heart failure, atrial fibrillation, lack of left ventricular filling, aortic stenosis, aortic regurg, and occasionally carotid stenosis as well. All right, so then what's my neurovascular uncoupling? You got a baseline metabolic rate of a neuron, and you got a baseline oxygen and glucose delivery. They should be coupled. They should match each other. Look at caffeine, how stupid caffeine is. It'll increase the metabolic rate of the neuron, but it'll drop. It's a vasoconstrictor, drops the oxygen and glucose delivery. Now, if you eat some sodium, you'll vasoconstrict, meaning narrow the arteries, and you make that gap even wider. Okay, you're psychologically stressed. You increase the metabolic rate of the neurons, more glutamate release at the synapses. Okay, sleep deprivation, that also causes the equivalent of psychological stress. Corticosteroid medications, aspartame is excitotoxin, glyphosate, excitotoxin, MSG. So you can see how this is getting wider and wider. The wider this gap gets, and this, by the way, is my theory, the Peter Rogers theory of neurovascular uncoupling as an explanation for causes of dementia. The wider this gap, the more these neurons are going to go into apoptosis. So yes, people should avoid aluminum. I totally agree with that. I think everything he said about that, I agree, and I think it's true. But I think he's really understating the things that cause dementia. There's a lot more to it than that. All the mitochondrial inhibitors, all the SERCA inhibitors. I go through videos on all these things, by the way. And then there's, of course, the theories, the prion theories of beta amyloid. And I go into that too, like especially Douglas Kell and Escherichia praetorius has the best one on that. Okay, so that's what I'm saying. I think he's oversimplifying by far what's causing dementia, okay? And he's overestimating the importance of aluminum, which is important, but it's not anywhere near the whole story. Okay, the next thing. What else do I disagree with Dr. Mcdougall about recently? He also says to everybody, hey, there's no conspiracy or anything. It's just, the farmers want to sell their meat. The dairy farmers want to sell their dairy milk and other products. And even the farmer's wife is fat. They eat the same stuff themselves. It's just all about money. It's all about money. And I think he means well. I think that's a little bit of an old school way of thinking, though, that, oh, you know, you don't want to make people worried or anything. I think it's a little more than that, okay? And why would I say that? Because, you know, it's not just milk. Milk is now in pregnant cows. That means the cows have high estrogen because they're pregnant, so the milk has high estrogen. That's a big part of why a lot of kids are going into puberty early, especially little girls. Okay, in addition, though, high estrogen levels in the human body will cause increased risk of breast cancer, increased risk of uterine cancer, increased risk of prostate cancer, and can cause infertility, contribute to infertility, okay? What is subsidized? Soy is subsidized, very high in estrogenic chemicals. It activates both the beta and the alpha receptors. Okay, if you actually read the papers, you'll see that's the case. A lot of people try to say it only activates the good one, not the bad one. No, it activates the secondary sex characteristics as well. So the point is that can damage the reproductive tract, lower sperm counts, more infertility, okay? Atrazine on corn is subsidized. That's the one that turns the male frogs into female frogs. Estrogenic can contribute to infertility, okay? Vasectomy and abortion are heavily promoted. Vasectomy is permanent sterilization of men, okay? And it's a lousy surgery. I've seen tons and tons of complications with vasectomy when the guys end up with painful scrotums for the rest of their life. Okay, tap water contains EE2, ethinyl estradiol, birth control pills. They don't get filtered out. It's too expensive to do carbon filtration in municipal water supplies. So they've got estrogenic chemicals in there, not to mention the PCBs, the BPA, the phthalates, and other ones. Okay, so what I'm saying is there's a lot of things contributing to infertility and making people fat and sick and stupid. Okay, tap water, why does it contain F-? It's a well-known neurotoxin, lower sperm counts, okay, increase in infertility. Yeah, everybody wants a phone nowadays, but people aren't well educated about don't wear them in your front pocket. Tons of guys put their phone in their front pocket, microwaving their balls. They're not taught not to put their laptops on their lap, microwaving their balls. Women are putting cell phones in their front pocket, microwaving their breasts. What I'm trying to say is the lack of education of the public with common things, as well as, you know, poisoning of the water, poisoning of the food supply. It's so ubiquitous. I don't think it's by accident, okay? Every woman in this country, every single adult woman, I bet you could not find an adult woman who does not know pink ribbons are associated with breast cancer. Anytime there's some talk about breast cancer, somebody dies from breast cancer, there's a bunch of women running around with a pink ribbon, okay? And I know they mean well. They're just giving money to the chemotherapy company. I never seen any of them. I went through med school, first in my class. I never learned anything about estrogenic chemistry, about their, you know, association between deodorants and breast cancer, and bras and breast cancer, about how the body excretes estrogen in meat and processed food cause increased blood levels of estrogen. None of this stuff was taught. None of it. Not a whisper of it, including on OB-GYN rotations. Every type of sex is celebrated in modern society, except for sex within marriage, heterosexual, that produces children. Oh, that's taboo. That's bad, okay? What I'm trying to say is, I don't think it's a coincidence. There's this massive converging effort to depopulate, lower the population of the proles, and to sterilize them. I don't think that's a coincidence. And I actually think a smart mind is skeptical and suspicious until proven otherwise. You know, later on, you might have your fears relieved and you say, oh, it's a whole lot of nothing. But when too many things all converge on the same point, that's called consilience. A bunch of small things which each by themselves seem inconsequential. When together they all point in the same direction, it's reasonable to suspect that it's not, you know, by accident. So, and I think people are wiser when they think that way. So, for their own sake, I think people should be worried and should be learning about things as much as they can.